And 28,000 people in San Diego County have gotten a COVID-19 booster shot. And we're now getting a deeper look at who those people are. County just started to release demographic information on boosters this month. ABC 10 News reporter Jared Ahrens takes an in-depth look at those numbers and how the effort to get people boosted faces many of the same challenges that we saw a year ago during the initial vaccine rollout.
Yo soy promotora de SAOB Community Services.
Since the beginning of the pandemic, promotoras, bilingual advocates for COVID health, have been crucial to getting information, tests, and vaccines to San Diego's Hispanic and Latinx community. Now they'll be used to promote boosters as well.
Either with iPads, they're talking to their neighbors, their friends, people they see every day, and really helping walk them through the process of getting an appointment done.
New numbers from the county show the Hispanic Latinx community has the biggest disparity when it comes to booster shots. They account for 29.8% of San Diego's total population, but make up just 15.7% of people getting a booster. Language and low access to technology are the biggest barriers for that group. Meanwhile, Black or African Americans, who make up 5.1% of the county, have gotten 2.5% of the booster shots. White people at 47.6% of the county have received 51.8% of the boosters, and all other groups, who combine for 17.4% of the population, have gotten 30% of the boosters.
We need to make it as easy as possible for people to get a booster.
Dr. Abisola Olulade, a family medicine doctor at Sharp Reese Staley Medical Group, says it's concerning to see all the numbers so low. The group she's most focused on, the elderly, where only 41.1% of people 80 years and older have gotten their booster.
That is concerning because as someone gets older, their risk of dying from COVID actually increases.
A deeper look at the age demographics shows a sharp divide between young and old. People 60 years and older have gotten 57.3% of the boosters, but make up only 25.4% of the total population. The youngest group, 18 to 29-year-olds, have gotten just 5.5% of the boosters, even though they account for nearly the same number of San Diego's people, 24.7%. Part of the reason is time. Older people were approved for a booster much earlier in the year. But Dr. Olulade also thinks confusing mixed messages from the CDC and FDA over who should get the extra shot are to blame. She says the message from health officials needs to be more specific, innovative, and direct.
Getting trusted messengers out in the community and talking to people at the level that they can understand. This is something that we expected, and it doesn't mean the vaccines aren't working, but it is important that you get that booster to get that additional protection.
Dr. Olulade says we need to make it as easy to get the booster shot as it is to get any other kind of medical care, and the messaging around it needs to normalize the shots the same way we talk about the rest of our health care, like a flu shot or a yearly physical. She says that will help more people understand why they need it and give those booster numbers a boost. Jared Ahrens, ABC 10 News.
Now, the county updated their numbers yesterday evening, and we have put a link to the demographic breakdown of booster shots on our website, 10news.com.